developments are being made in the HIV field all of the time, though so far a complete cure has eluded us. Indeed, medications are now so good that HIV is a livable condition, just like any other chronic disease. Prior to 1995, this was not the case. It was in this year that the so-called triple cocktail came out. That is a combination of 3 different HIV medications, which work against different stages in the viral replication process we discussed in detail earlier on in this training. The triple cocktail was the first truly effective treatment for HIV, and as such after its introduction death rates began to fall dramatically. You may hear the triple cocktail referred to by other names such as HAART. This stands for highly active antiretroviral therapy. In the early days of HAART, it was necessary to take large numbers of pills every day. Luckily the numbers of pills have been reduced significantly, so much so that today some patients only need to take 1 pill a day. With 3 or more HIV medications being combined into a single tablet. This obviously makes managing one's medication much easier, and may improve the ability of people to stick to their medication, as it causes less disruption to their lives. Newer medications also tend to have less side effects. For those who have possibly developed some degree of viral resistance, because they have been living with HIV for a long time, newer classes of medications such as integrase inhibitors and entry inhibitors offer additional treatment options. After the reverse transcription of RNA into DNA is complete, HIV's DNA must then be incorporated into the T cell's DNA. This is known as integration. As their name implies, integrase inhibitors work by blocking this process. Entry inhibitors work by preventing HIV from entering healthy T cells in the body. Microbicides, which are usually in the form of a gel, can be applied to the intimate area prior to sex, and may be contained within lubricants and condoms, contain chemical agents, which are able to kill HIV in bodily fluids, such as semen and vaginal secretions. HIV-specific microbicides have now been developed. However, it must be pointed out they are not 100% effective in preventing HIV infection, and should be used in conjunction with other prevention methods. Because of its ability to randomly and very quickly mutate, HIV is very difficult to target with a vaccine. Up to now trials in animals and humans have been unsuccessful, though development are being made all the time, as our understanding of the virus grows. Potential cures are also becoming more likely. For example, the so-called Berlin patient. The Berlin patient received a stem cell transplant from a donor naturally resistant to HIV, and has remained off antiretroviral therapy since the first day of his stem cell transplant. Such a stem cell transplant will not, however, work for everybody, and furthermore is only effective against certain strains of HIV. Finally, the most promising development is so-called treatment as prevention. We detailed this earlier with PrEP. Pre-exposure prophylaxis, or PrEP, is a way for people who do not have HIV but who are at substantial risk of getting it to prevent HIV infection by taking a pill every day. The pill contains 2 medicines that are used in combination with other medicines to treat HIV. When someone is exposed to HIV through sex or injection drug use, these medicines can work to keep the virus from establishing a permanent infection. When taken consistently, PrEP has been shown to reduce the risk of HIV infection in people who are at high risk by up to 92%. PrEP is much less effective if it is not taken consistently. PrEP is a powerful HIV prevention tool, and can be combined with condoms and other prevention methods to provide even greater protection than when used alone. But people who use PrEP must commit to taking the drug every day, and seeing their healthcare provider for follow-up every 3 months. Treatment as prevention can also refer to getting as many people infected with HIV as possible onto treatment. When they are on treatment, the aim is to reduce the level of virus in their blood to undetectable levels. This is done through the prescription of HIV medications. We can measure the quantity of the virus in someone's body by conducting what is called a viral load test. When undetectable levels are reached as a result of medication, it is highly unlikely that someone can pass the virus on to others.